Hello, everybody, and this is Dr. Lynn Klima, and I'm going to be your speaker today for our talk, Preventing Workplace Violence in the Home Care and Hospice Setting. This presentation is going to focus on the critical issue of workplace violence within home care and hospice settings, highlighting its importance and the unique challenges faced in these environments. You will gain a comprehensive understanding of workplace violence, including its definitions, types, and the specific statistics and risk factors prevalent in the industry. I'm your speaker for today. I'm an adult nurse practitioner with over 40 years of experience across acute, primary care, and community based settings. Over the last 12 years, I've worked as an academic associate nursing professor with a teaching focus on nursing leadership and therapeutic communication, community health, geriatrics, hospice, and palliative care, both at the graduate and undergraduate levels. And I'm currently serving as a patient safety officer for QAPIplus PSO. Speakers for this presentation have no financial interests, relationships, or other potential conflicts with respect to the material which will be covered in this presentation. This course is not a substitute for legal advice for any individual provider or situation. You want to make sure you always consult with your company's legal or compliance personnel with any questions or concerns related to the subject matter. So the objectives for our presentation today are to gain a comprehensive understanding of the various forms of workplace violence, learn to implement practical prevention strategies, and understand reporting procedures and response plans for workplace violence incidents. All right, so let's talk a little bit about workplace violence. It's defined as any act of physical violence that threatens behavior or harassment that occurs in the workplace. Addressing workplace violence in home care and hospice settings is crucial for several reasons, and so we want to have a strong foundational introduction. First and foremost, when you think about the environment where we're working in, it's really unique, and caregivers often work in clients' homes where there's already feelings of vulnerability and potential triggers for conflict may be heightened. This can create situations where caregivers are at risk, potentially leading to both physical and emotional harm. Let's think about that, an introduction in terms of violence in healthcare. We know you can't open a piece of literature or see something in social media or even on TV where we can see that violence against healthcare workers is a serious and growing concern. It affects patient care, worker well being, healthcare delivery. So, today we're going to explore the issues, the impacts, and some potential solutions. So, one question to think about is, have you or someone you know experienced workplace violence in a healthcare setting? So, think about that as we go through the statistics and the situations in our discussion today. So, preventing workplace violence in home care and hospice is essential to protect the well being of workers and to ensure the continuity of care and uphold the values of healthcare services that we're trying to provide. Addressing workplace violence contributes to a positive workplace culture where team members feel empowered to share their concerns and support one another. So, that's one of the hallmarks of this. We want to be able to make sure that we feel like we are respected and also supported in terms of where we're working. So when we think about prevention, first off, the home care and hospice workers, like we said, have unique threats such as working in isolated environments, handling medications, and dealing with clients experiencing emotional distress. Preventing workplace violence is crucial to protect all of us who are in this vulnerable situation. Establishing appropriate measures, security measures, conducting risk assessments, and having training programs that can create a safer work environment for staff allows us to be able to focus on providing quality of care. We also want to promote a culture of respect, fostering a culture of mutual understanding, empathy, and respect between our patients, families, and staff can help reduce the likelihood of violent incidents and create a more positive atmosphere. Today we're going to explore, like I said earlier, different facets of workplace violence and its implications, and prioritize how we can focus on prevention of workplace violence so that it not only enhances the safety of our care team members, but also the overall quality of care that's provided to our patients. So let's define workplace violence. So the common definition is any act or threat of physical violence, harassment, intimidation, or disruptive behavior in the workplace. It can occur between workers, patients, visitors, and others, and it can range anywhere from verbal abuse to physical assault. So think about what form of workplace violence do you think is the most common in healthcare? All right, so again, workplace violence refers to any act or threat of physical violence, harassment, intimidation, or other threatening disruptive behavior that occurs at the worksite. It can range from threats and verbal abuse to physical assaults and even homicide. Physical assault involves unwanted physical contact or the use of force against a person, such as hitting, kicking, pushing, shoving, or throwing objects. Threats can be anything that are verbal, written, or implied and involve the intent to cause physical harm to a person or their property. Harassment. Harassment includes unwelcome behavior that is intended to disturb or upset and can take the form of verbal comments, physical actions, or other gestures. And intimidation refers to behavior that is intended to frighten, coerce, or force, or introduce fear in another person. So, in order to really address workplace violence, it's really essential to understand the different types of violence that can occur within the home care and hospice setting. Workplace violence is not a one dimensional issue. It encompasses, like we've said here, various behaviors or actions that can adversely affect the safety and well being of our patients and employees. The three primary types of workplace violence are physical violence, verbal abuse, and psychological abuse. Physical violence is perhaps the most overt form of workplace violence involving that actual physical harm or the threat of physical harm to an individual. This can range from hitting, pushing, or other forms of assault. In the home care or hospital, caregivers may face physical violence from clients or their family members, or family members who may be witnessing their family member having deterioration of their health conditions. And these situations can escalate quickly, leading to potentially dangerous encounters that not only threaten the safety of the caregiver, but can also create an unsafe environment for clients. Verbal abuse is another significant concern, and this form of violence involves hostile, threatening, or abusive language directed at an individual. In a home care setting, caregivers may encounter clients or family members expressing anger, again, frustration through shouting, insults, negative or derogatory comments. While verbal abuse may not leave physical scars, its impact can be profoundly damaging, contributing to a toxic work environment, lowering morale, and leading to increased stress and burnout among staff members. Psychological abuse, although less visible, is equally insidious. This type of violence may includes any behavior that can cause mental or emotional harm, such as manipulation, threats, or coercive or forceful control. In the context of hospice and home care, psychological abuse can manifest as gaslighting, isolation from resources or support, or intimidation tactics employed by clients or their loved ones. This kind of abuse can have long lasting effects on a caregiver's mental health and job performance, often leading to anxiety, depression, and a decreased sense of professional efficacy or effectiveness. So when we start to think about the different forms of violence that violence can take, it doesn't always, we always think of maybe that physical violence, right? So we want to be able to think about all these different things that encompass that violence towards healthcare workers. And by recognizing that there are different forms, we can start to be better equipped to identify those potential risks. So again, we want to try to put prevention measures in place as much as possible and implement necessary measures to protect both staff and patients. So we're going to talk a little about each of these areas more as we go through this presentation. All right, let's spend a few minutes now talking about some of the implications and understanding workplace violence. So we already talked about the different types of violence that we might see in that home care and hospice setting. It's important to understand the risks and implement effective prevention strategies. Um, Home care and hospice agencies really are obligated to create a safer work environment for their staff and their clients. And so we want to make sure that we're honoring that and having not only an opportunity to really identify those forms of violence, but understand what to do and how to prevent it. Um, what we know from the research is that home care and hospice staff face a higher risk of workplace violence, including physical and verbal abuse, due to the nature of their work and the vulnerability of their clients. And we also know that we will come into contact with different forms of violence, such as physical attacks, threats, intimidation, and even sexual harassment. It's important to prevent those events from occurring, and really it starts with our assessment, and we'll talk more about that as we go forward, and then practicing some effective de-escalation techniques. So research looks at the fact that, healthcare professionals, including those in home care and hospice, face a significantly higher risk of workplace violence compared to other occupations by virtue of where we're delivering our care. We're in, of what's considered to be a vulnerable setting. It's a unique environment in healthcare where we're in the patient's home or a family member's home. In many cases, they have, the impact of the complexity of the chronic conditions that they're facing and dealing with, the changes associated with that, or they might be in that end of life space. And, this is also a very vulnerable time for patients, and emotions and feelings are really high, among patients as well as their family members. And so that just already sets the stage for the environment being a risk factor, right? It's something that we have to be considering about. When you look at the research, it says that healthcare workers are 4 times more likely to experience workplace violence than individuals in other professions. And this has an impact on care delivery overall. It's very disruptive in terms of our ability to be able to be physically and emotionally and present for our patients, worried about, compromising our own well-being or the well-being of others. So what we know is that already being in the home is a stressful, environment. The impact of what's happening with the patient and their diagnosis and their treatment plan. We also know that, with the mental health or substance abuse issues can also fold into this and make things more challenging. There really isn't the same level of security at all compared to facilities. And then sometimes patients maybe have to wait, there might be a delay of care or services for a variety of different reasons, and maybe they're, frustrated or uncomfortable with waiting for a response to that treatment plan. So these are some of the things that call themselves out in the literature that might be factors in terms of why, not only the environment, but also just the patient's feelings toward their care might be, a risk factors in and of themselves. So, are there other things that you might be able to think about in terms of uh, risks to violence in healthcare settings? Think about that for a minute, your own personal situation. So in 2018, the United States Bureau of Labor Statistics indicated that 73% of all non-fatal workplace injuries from violence occurred in healthcare settings, and likely it's really underreported. So we really want to grasp the seriousness of workplace violence. We need to consider thinking about these statistics, right? Um, we know everybody has had some sort of a professional experience where maybe they felt uncomfortable or things were more violent than they needed to be. So especially around verbal or psychological abuse, not necessarily always physical abuse. So we want to be able to think about about that in terms of our own work. Many incidents go unreported. So it's documented that nearly 70% of cases lacking documentation due to the fear of repercussions or skepticism about the reporting process. So really understanding what I experienced, was it really, did it fall within violence, towards me or towards others in the home or towards the patient? Um, does my documentation reflect what I saw? Should I be reporting this? Who should I be reporting to? How do I do that? Sometimes we need that validation, right? Talking about what we saw or what we experienced to be able to feel confident that yes, in fact, that was an incident that we need to be documenting and be aware of, not only for the safety of ourselves and other team members, but also safety for what's happening in that home related to the patient care that we're seeing. So, some of the outcomes of violence that we might see, that there are physical injuries. I mean, you can't turn on the news at any given point or read an article to know that workplace violence is significant across the healthcare industry, and those incidents are being reported, and there's a lot of um, you know, uh, now not necessarily knowledge, but a lot of information around this happening more frequently depending on the work setting, right? So we hear a lot about acute care settings and hospital settings, and particularly around emergency room care. We also have to remember that we're in a space that also has the opportunity to have those events take place. And the outcomes could be physical injuries to us, psychological trauma, so just, emotionally dealing with, the what's happening with the patients and the experience that you're having when you're going into a home, whether you're treated badly by the patient, by the family members, by caregivers. And this leads to burnout and job dissatisfaction, and ultimately also a decrease in the quality of patient care, right? If we can't be can't feel safe about the care that we're delivering or confident about the environment that we're going into when we're going to be delivering this care, it's going to have an impact not only on how that patient is treated, but also our satisfaction with the work that we're able to do. And these impacts, overall impact our healthcare system. So we know that there's already a shortage, and staffing is an issue across all sectors. It's not just in acute care, it's also in home care and hospice as well. So again, just as a reminder, we're providing essential care and support to individuals in their homes or maybe even in hospice facilities. And these are people that are dealing with complex medical conditions, end of life situations, challenging and physical and emotional environments. So already the emotional, climate in that in for that patient and their family is already high, right? And so our introduction of ourselves and our team and our work into that, we have to be aware of this, right? We're walking into these settings that we aren't really sure what to expect. And so our assessment and how we, approach these patients is, really important in terms of setting the tone for our relationships with them. So when you look at workplace violence, it's often considered more prevalent in healthcare settings, and the types of violence involves aggressive behavior directed at employees, patients, clients, or their family members. So while worker-on-worker violence and personal relationship violence are significant concerns, it's really more patient-client violence tends to be more commonly reported, particularly in environments like healthcare, retail, social services, where employees frequently interact with potentially volatile individuals. So, criminal intent, while serious, typically represents a smaller proportion of overall workplace violence incidents compared to the types that we're talking about. So, what type of violence do you think is the most prevalent in healthcare settings? Criminal intent, customer client, patient or visitor violence, worker on worker, or personal relationship. So it is that customer client that is the the most prevalent that we're going to see. So when we think about, uh, who's at risk, we've already talked about healthcare workers, our role, those especially in home care and hospice, because of where we're providing our care, and we know that we're underreporting. So just to recap that, and the types of violence, according to the Bureau of Labor Statistics, um, you know, is really healthcare and social service workers experienced approximately 73% of all non fatal workplace injuries and illnesses caused by violence. So, this includes physical assaults, which are more frequent in home care compared to other industries. So, we also know there's an impact on mental health. So, research shows that up to 60% of home health caregivers experience psychological distress due to exposure to workplace violence, which can lead to anxiety, depression, and burnout, and underreporting of incidents. It's estimated that workplace violence incidents in home care are severely underreported. A study found that nearly 70% of healthcare workers did not report the last incident of violence they experienced, often due to repercussions or skepticism about reporting processes. So, this is an important thing to know, right? How is your organization? What is your policy around reporting violent events in the home that happen either between patients and family members that you're assessing or observing, or events that happen towards you? And that's the piece that often gets underreported. If we see something about a patient interaction between their family member, that reporting does, often hit our incident reports. But when things are, towards us, especially around that psychological or verbal abuse, we don't often report that, right, in an incident report fashion. We might maybe say something in our documentation, but that's not always clear, right? We're more accepting of what patients or family members say to us or how they interact with us. We might talk about it with our team members, but we're not capturing those incidents and documenting them. However, if we see something that happens with a patient or towards a patient or between family members, we do, document that, but it's still underreported. So we want to make sure that we're, what we're seeing, what we're evaluating, what we're assessing, that we're asking our leadership staff, how do we report this? This is what I've seen. This is what I, believe to be happening. These are my concerns. How can we get this documented and reported? Okay, we already talked about that. So, types of violence, we've already talked about this too, verbal abuse. So, again, this is really high. 64% of home care and hospice workers have experienced verbal abuse from clients or their family members, right? So, think about your own experiences here. And physical assault, it's less, 25%, but still, that's pretty significant. So, we want to make sure that we, again, are, recognizing what's happening and knowing that this is, what the literature is telling us that we're seeing across, the industry. And so if you feel like you're being, verbally attacked or verbally assaulted, you want to make sure that you're reporting that. So when you think about what are those things that I can assess, right? So in order to be take a preventative or a proactive approach, we have to know what those risk factors are. So first of all is working alone, right? So when you think about where we're working, we often might be, going out to a home visit by ourselves. It might be in a remote or isolated area, or it might be an area that maybe is, not as safe as we would like, right, based on crime reports and those kinds of things. And so, when you don't have other people around, you have to know what are your proper safety measures, such as, what is my check in process? What are our emergency protocols? Who should I be calling? Should we do a visit together? Are we concerned enough that we want to make sure that there's a team of us? How does that look? Or am I on the phone and is somebody else in the home? Make sure that, that's a part of your assessment. How do we work together so that maybe we're minimizing being in that space by ourselves at a time that maybe isn't appropriate? Trying to kind of prevent that from happening if possible. Handling valuables, right? So again, if you're handling cash, jewelry, or other valuable items that are potential targets for violence, what you keep in your car, what you carry on your person, all those kinds of things are important, right? Making sure they're locked in your trunk, that they're not visible in your car, whatever that car looks like, what you're carrying in your bag, what you're wearing, those kinds of things. If you're dealing with patients with a history of violence, which happens, right? We're going to have patients who interact or patients that we interact with or clients with a documented history of violent behavior. We just need to be aware of those and increase risk and take appropriate precautions such as having, more of a presence there or maintaining a safe distance. So again, what does your organizational policy tell you? I've worked in organizations where if we were doing a visit in a certain area within a neighborhood, we might contact the police department to be available for us, or we might bring another person out to the team, or we're letting a team member know we're going out to this area and we're doing it a certain part of the day that may be a safer part of the day or feel like a safer part of the day because there might be less community activity going on, like maybe early morning visits or those kinds of things. So again, assessing, who is your patient, what is their history, where do they live, what's in the home, should, maybe if you have concerns right from the very beginning, maybe it's a dual visit with someone else. And I know, these are all, things that sometimes aren't always possible, but those are things you want to talk about with your interdisciplinary team and your managers to kind of figure out what's the best practice, what's the best way. How do we, do some of these kinds of things? Is a telephonic visit or a virtual visit more appropriate at certain times? Again, your organizational policies, resources are going to dictate or help drive those processes. So you're going to need to know what those are. Unstable or volatile work. So workplaces also can be high levels of stress, uncertainty, or conflict may create an environment where the risks of violence are heightened. Addressing underlying issues and promoting a culture of respect and communication can help reduce those risks. So again, looking at, where are you going? What is that work situation like? We're talking mostly about home care and facility visits here. But if you work in a space also, where your home base is, that also might be a vulnerable location that you want to be paying attention to. Lack of security measures. So again, we're going into home spaces, so we know that this is already an issue. So what are those policies that you have in your organization around security for risk or risk mitigation? And then training. So we want to make sure that we're having training available as we're doing these. So some of the prevention, strategies is making sure that we have safety measures in place that are going to reduce the likelihood of violent incidents. And so this can include security protocols, making sure you have annual trainings on recognizing and responding to threats, and fostering a culture of trust, respect, and open communication. Great way to do this is case studies, right? So having bringing a case study approach if you're a manager or leader to a staff meeting, a team meeting where you're talking about a situation and you're kind of working it through and looking at your policies to make sure that everybody is aware of them, that your policies address all these critical points, and that folks know what they are and how to access those resources. Because you don't want to be figuring it out in the heat of the moment. So a case-based approach to walking through those things are important. Another time and space is, immediately after an event maybe took place and debriefing on those events to be able to identify were there gaps in our policies? Was it a knowledge thing? Are we missing a component here? What was it that caused, the issue to take place, and how do we address these things together, right? So that we're being proactive and we're being aware of them. So one organizational approach is to have a comprehensive violence prevention program, right? What do your policies dictate? What is your violence prevention plan? How do you all know what it is? Where is it documented? How do you practice it, right? Just like tornado drills and any other kind of emergency protocols. How do you, work on workplace violence and making sure that you have something there? And again, we want to make sure that we're folding in that verbal abuse into this as well. And, what are our assessment practices? How does it get documented, communicated? And then what is our team approach to this? How do we approach this patient and family? How do we work together? At what point does that, patient if they need to be, discharged or excluded from service, is that called into your policy? It's not always the ideal, right? We don't want to do that, but what can we do to, promote this? Make sure that we have that workplace violence training in place. And we're fostering that culture of safety and support. We encourage that incident reporting so that we can dialogue and see where are the trends, what's happening out in the field, and that we can, shore up those policies to be a little bit stronger and that we're responding to them early so that we can, again, be proactive. We also know that, from a legal and regulatory framework, the Occupational Safety and Health Act, OSHA, has a general duty clause. There's also state specific laws and regulations in terms of violence prevention and what needs to be incorporated or put in place for employers to support their employees. And then if you are accredited, the Joint Commission also has standards for healthcare organizations. So, again, this is a big issue in the news right now in terms of stronger legal protections to protect healthcare workers across the board. So this is not unique to home care and hospice. We just happen to be working in a location that puts us in greater risk because of the vulnerabilities that we've already talked about. So we want to be able to make sure that our policies and our practices are in alignment with what those regulatory requirements are, and then what our state and local requirements are as well. So in terms of employers, they're really responsible for that overarching policy in terms of what is that, how are we going to address and prevent workplace violence? And it should be a comprehensive violence prevention policy that outlines the commitment to maintaining a safe and secure workplace, and then the regular training and education for staff. So, when you're thinking about organizational strategies for violence prevention, what's really important is implementing comprehensive prevention programs. And that includes conducting risk assessments, right? So, it's not like you write a policy and you let it sit on the shelf and you just dust it off and pull it out to be able to, talk about it in annual training. It's really looking and walking through, how are we following that policy? Are people aware of the policy? Have we had any incidents in the last 3 to 4 months that would have impacted how we maybe need to make some changes or revisions to the policy? So really assessing, how does your policy affect or impact your staff's ability to be and provide and be present for safe patient care, right? Where are the gaps in there so that you can continue to improve upon them and enhance those safety security measures? So again, if you've assessed, maybe that the patient, is in a very highly emotionally charged environment for whatever reason, maybe as a part of your interdisciplinary team meetings, you're talking about ways that the team can work together to be able to support each other so that it is a safer environment. And how is that documented and supported so that staffing, can be, rearranged or adjusted so that there can be, two members of a team that are going out there, or, whatever the issue is, whatever you want to do to be able to improve, that support to those staff out in the field. So in your policy, you should have a scope and purpose. You should have clear definitions of, what constitutes a workplace violence, including physical attacks, threats, intimidation, and other disruptive behaviors. Reporting procedures outline the steps for reporting incidents of workplace violence, including contact information for designated personnel or departments responsible for receiving and investigating reports. So, when do you call 911? How do you contact the police? Will the police in your community give you an escort if you have to go out into the home and do, services? I've worked in areas where sometimes that wasn't an option, and in other communities it was. And so, knowing that, right, as a leadership team, who are those resources that are available to us, and how do we leverage our collaboration together to be able to support ourselves so we can provide care, but in the safest ways possible. Response and investigation. So you want to have in your policy, what is our process for not only reporting, but then responding to and investigating those incidents, including the roles and responsibilities of the management and any other personnel that would be included in that. And then training and awareness. What is your organizational training process? How often do staff get trained? Who participates in them? How do you document that? what's your, goal with that in terms of completion rates, and how frequently does that need to happen? Does it happen at new hire, but then how do we kind of do that routinely or on an annual basis? And then any disciplinary measures that will be taken against individuals who engage or threaten workplace violence. So again, this is really more around internal team violence, or, disruptive behaviors, like, worker to worker. What do those policies look like? So a lot of components. And in most cases, people have a couple of different policies related to this. There might be human resource policies, there might be clinical policies, there might be medication policies around how substances are handled in the home, which also is kind of creating a risk factor for us, right? With when you think about some of the pain management medications that are put out into homes, how do we fold that all in? So it's all encompassing, right? So how we treat each other, how we work together, how we're forward facing with our patients, what are we seeing, what do we do when we, have a patient or a situation that's more volatile there, and then what are some of those preventative policies that we have to secure things in the home that might be vulnerable or create a vulnerability for the patient, like pain medications, so that we can have a plan in place, right? So you can't look at all of them. They all may be independent, but they all would really kind of fall within one program, right? How you're addressing violence within your organization. So, generally, most people go through regular staff training in violence prevention in your organization. I encourage you beyond this training. This is just kind of a high level overview to really then go on and move forward with talking about what your organizational policies are, and sharing those with staff, and having simulations and role playing or case studies, right, like we talked about, and folding in those crisis intervention techniques. What do we do to de escalate a patient or a family or a coworker when we have, an event that's taking place? And what are those techniques? And if you have social workers on your team, or a security officer for your organization, those are really good strategies to bring them in to be able to practice some of those techniques in place. And, one of the questions here is, how often do you think healthcare workers should receive this type of training? I mean, we are accountable to do it at least at orientation and once a year, but is that enough? Do we need to have it more frequently so that we're, again, mastering those techniques, feeling more confident about our ability to assess, and looking at, do we beef up these policies, right? So there might be an opportunity after an event, or when there's a risk identified, how do we kind of dust this off and bring this up, and how are we going to do it together? So it really should be kind of more fluid than just a once a year, I got to get this done and check the box. How do we really kind of, work through these so that we're feeling more confident in what we're doing? Now, for us, we have some responsibilities too, right? We're talking about going into a situation that's more vulnerable for a lot of our patients. So we have some responsibilities as well that are going to try to minimize the disruption to the patient and the family in the best way that we can. So first is being on time, right? So if you're going to have an appointment or a visit scheduled, making sure that you're honoring that appointment time as best you can. And if you can't, if there's a delay or something needs to be changed, communicating that, responsibly, and as timely as possible, with an explanation of why that is, right? So that communication is so important. Making sure, this seems really simplistic, but we're introducing ourselves. We're guests in somebody's home. So who are we? What's our role? How often we're going to be there? What's the purpose of our visit? What can we help them with? Asking permission to enter. You don't just want to kind of barge in there, but again, asking, would it be okay if I came in? Where would you like me to sit? Where would you like this visit to take place? Kind of putting some of the control and onus back on the patient and their family, so you're not just sort of dictating how that experience is going to go. Also, make sure that you're being respectful of that home environment, where you park in the driveway, right? People don't like that necessarily. Where should you park when you come? Would you like me to park on the street? When I'm here, making sure, you know, protecting their floors, so putting shoe coverings on, making sure that you're not, leaving a mess or anything, when you walk into that home, you're, protecting, uh, you know, what's there, what you're seeing, their belongings. Communicating effectively. So again, that clear professional communication with the patient and the homeowner throughout the visit, making sure that you're aware of and following those safety protocols. So, again, if you're not sure about what you should be doing, this is a call to your manager. This is what I saw, this is what I'm worried about, these are what I'm concerned about. Where can I go for more information about this? Also, I talked about keeping things clean, but properly disposing of waste, making sure that you're not leaving anything behind for that patient or family to clean up. You want to kind of like the state parks untouched, like they don't know that they know you were there, but there's no remnants of you being there. So you don't want to leave anything there. And then ask for feedback. How could this experience go better the next time I'm here? What is a better time of the day? Would you like me to, really kind of inviting them to be engaged in having some control, because a lot of the anxiety and emotion that people in families have that kind of sets the tone for that vulnerable environment is they're unsure about what's happening with them, and they don't have as much control maybe as they once did, and they're uncertain about their future, what this treatment's going to do for them or how it's going to impact them and their family. So again, anything that we can do to invite them into that process, to encourage them to give us feedback about how things could go better or what they would like, and individualizing that visit for them or those future visits for them is going to go miles in terms of building that relationship with them and ease some of their anxiety. So again, before we even start doing visits, is there an opportunity to conduct thorough risk assessments? What do we know about the patient, their mental state, any, history of violence or potential issues with their family, whatever we can find out, right? That pre-work is really important. Also communicating with the client in advance, so reaching out with them to set expectations, when we're going to be there, who's going to be there, what you want to kind of cue them up for, and any concerns they might have, so that you can be ready for them. And then create a safety plan. So you want to make sure that, if there's anything that you need to be doing in before you go, this would really be important, right? So what is that? Ensuring that you have, what's going to happen as a backup strategy, who you are going to contact if emergency services are there. So again, this is really just about your organizational policy and you knowing what you should be ready for before you go into that visit. And then if you are already concerned through that, pre-risk assessment, is there something or someone that can go with you in terms of, coming there? So by implementing pre-visit strategies, you can enhance your, personal risks and minimize your risks and conduct when you're going out for that visit. So again, so elements of a pre-risk visit, what should I be looking at, right? So in the record, any behavioral concerns such as aggression or violence, their health status, do they have any cognitive impairments, mental health issues, or unstable medical conditions that could affect their behavior? In the home, are there any potential hazards, cluttered paths, loose pets, or inadequate lighting? So again, some of these things are things that you can ask if you can do a call to the family before you do that visit, or maybe, you're kind of, it's your first visit and you're figuring that out. But a lot of times folks will call and just ask, where should I park? Is there anything I should know about your house? Are there steps I need to come up? Is there, where in the home would you like me to meet you? Do you have any pets? Make sure those are all, you know, they're all kind of tied up and put away so that you don't have to come in contact with them. Inadequate lighting, what time of the day are you doing that visit? Summer is a little bit easier or better weather, but in the winter, depending on where you're living in the United States, it's a little bit darker, even at the end of the day visits. So, lighting might be an issue as well. And then who else is going to be there? Are there going to be any other family members in the home? Any concerns that they might be there? Who's going to be their support systems? And any relationships. So some of this you're not always going to know before you get there. If you can ask some of these questions before you get to the visit, that's going to kind of give you some idea about what to expect. And then more of it you're going to be able to find out, early on, right? So as a part of that introductory visit or that admission visit. Also, the community and the environmental factors in the neighborhood, general security, crime rates, resources, you know, knowing that. And then we've already talked about emergency protocols. What's the protocol to do in a dangerous situation, including emergency contacts, the nearest medical facilities, and communication devices. And then any personal safety measures, right? So, what are some of those de escalation measures? Patient and family also have responsibilities, right? We want to make sure that they understand that they play a crucial role in creating a safe environment for the team that's coming in, whether it be, our your employees or also other caregivers that might be using. So making sure that they understand that they should share their concerns, questions, and provide important information to the team so that we know who they are and what their concerns might be as well, and be honest about those. That they're respectful, right? So we want to have them refrain from disruptive, aggressive, or threatening behavior that could escalate into violence. Treat staff with courtesy and respect, and then follow policies and procedures and other rules to maintain a safe, setting. So, what are those policies around your care? And then, if they have any concerns, have them know that they can work with the staff to address them, so that we can work them through and not let them get frustrated. So, again, it's all really about that communication. Some basic de-escalation techniques are, active listening. So making sure that we're listening to the patients and, validating with them what we're hearing, reflecting back that we understand them, that we hear them, asking those open-ended questions to get more information, right? So we want to listen more than talk. And repeat back to them. These are the things I'm hearing you saying. I understand that that's a concern. I respect that that's a concern for you. How would you like to be able to move forward to resolve that, right? Putting it back on them to be able to talk about that. But listening, right? Setting clear boundaries, right? Establishing clear boundaries and what behaviors are and are not acceptable, and explain the consequences if the boundaries are crossed. So maybe, we won't be able to do in-home visits. Maybe you'll have to use another agency. I mean, those are last resort sorts of things, but making sure they understand what those boundaries are. And then if you have a situation that does escalate, don't hesitate to involve, law enforcement, or call anybody, from a law enforcement team to assist in de-escalating the situation and maintaining safety, right? So you want to, make sure that you're listening to the patient, clear boundaries, don't speak to me that way. I understand you're upset. Let's see what we can do to resolve this. Um, I'm going to leave right now until you can calm down and we can bring somebody else in here. Being really clear about what's going to happen. Don't try to get closer to the patient and, try to fix it for them. You just want to listen to them and, kind of move forward and bring in the right people if you need to. All of this really needs to be reported and documented. So you want to, important to report all incidents, even something that isn't really didn't fulminate fully into maybe a violent episode, but that would be considered a near miss, right? So again, those verbal encounters or those verbal threats or intimidation tactics, maybe. And then you also want to make sure that you're documenting and that your policies have some clarity around what should be documented. And this should be non punitive, right? We want to make sure that we're reporting and we're encouraging that reporting of our team members, if you happen to be in a leadership position, shouldn't be punitive. And this data is only going to help you be able to look at what's happening and be able to come up with prevention strategies and improve your best policies. So think about how you document, what your documentation procedures are at your organization, and who looks at that. Where does it go? And is it evaluated? Are you looking at all of them? One of the benefits of QAPIplus, if you happen to be using that software, is it is a really good program to be able to do that documentation, and it's real time, right? So immediately after it's happening. I mean, it doesn't mean that you're right in the field documenting this, but you can document right away, and it gives you an opportunity to get that incident captured. And the manager and whoever else has been designated in the organization can review it and work on it. So it starts to give you some trends to be able to see what's happening. So, in terms of incident reporting, you want to be able to know that this is an incident that needs to be reported. So, recognizing it and reporting anything unusual or suspicious that may indicate a security incident. And then the incident gets assessed, right? So, what happened, the scope of it, the impact to determine what your response is, and then incident response activation. So, this means the incident has a plan. What do you do once you have this incident? What takes place? who's involved in that and what are those resources that we have to put in place. You also want to contain the incident, right? Take immediate action. So if there's something urgent that is a safety issue, you want to limit the spread and impact of the incident to prevent further damage or loss. So what do you do in the immediate moment? Who needs to be involved? How do you approach this? Kind of minimize it so it doesn't happen again. So if there's a urgent security risk or a safety issue that is concerning to the staff, towards the staff or towards the patient, you're going to immediately act on that uh, through leadership or law enforcement if you need to. And then the incident gets investigated, right? So post debriefing, after this all happened, let's look at what happened, what's the other evidence that we need to bring into play here. Really want to get to the root cause and identify the extent of the incident, and then put a plan in place to remediate it. What are you going to do for the most immediate care for that patient and family? What happens next? But then future forward, how do you assure that your policies support whatever happens? And then again, this all gets documented and reviewed so that you know what to do. The other thing that gets sort of lost in that is what happens post incident support. So again, to us, what's that immediate medical attention if there is a physical injury, but also what happens in terms of just that support, psychological support and counseling for post incident, right? Like to talk it through. And we all feel bad if a patient treats us badly or a family treats us badly. We don't really recognize the impact that it can have, the toll that it takes, or the burden that it is when we're getting that, those insults or that verbal abuse. And we want to be able to have that support. So, what supports does your organization have to do that? There's your manager, but you also have any types of, trainings or support within the organization to be able to help with that counseling and support, and then ongoing, you know, support to you so that you don't let that get to you. The other thing that's really important in developing a violence prevention plan at the organization is to have partnerships, right? So, who are those other partners that need to be involved in your plan? So, is it a bigger healthcare organization if you're a part of an organization, or your relationship with those organizations if you are a small independent facility, law enforcement and community groups? Again, working with patients and families in violence prevention efforts. I think a lot of our dementia patients, that verbal hostility and anger is not only hard on us, but it's also hard on the caregivers too. And, those are insidious, right? It just kind of builds, and we want to make sure that families know what to do or caregivers know what to do as well, to be able to, minimize the impact to them and prevent any, further violent actions that might take place. And then how do you work together with your interdisciplinary team? So these are just some basic ideas, right? This is a team approach and working collectively together, not only to support each other, but also to, for the benefit of the patients. How do you work together to be able to support each other in the field? So it's a call to action, workplace violence, right? Recognizing the seriousness of healthcare worker violence starts the right place, advocating for stronger protections and prevention measures, supporting each other and reporting those incidents. So the more we document, we're going to see the magnitude of this problem. And, what can we each do in our own practice, making sure that we're taking the time to see what can I do to be better about this in terms of reporting and being a part of the solution so that we can get to some better interventions to protect stapling. So this is, the importance of staff training, making sure that we're aware that the training programs are, addressing compliance and risk mitigation, and that we're continuously improving, right? NIOSH is an organization, the National Institute for Occupational Safety and Health. They are a group that's responsible for conducting research on workplace violence prevention and developing evidence based recommendations and collaborations with partners and implementing solutions. So there's a lot of research that's out there. A lot of organizational policies stem from some of the work of NIOSH. So just so that you're aware, this is an ongoing research organization. So, future directions in healthcare violence prevention is continuing research on effective interventions, development of new technologies for early warning and prevention, policy changes at local, state, and federal levels, and increased public awareness. So thinking also about how technology could play a role into this, right? So do you guys use a texting system? How do you communicate with each other while you're out in the field? We have to think about some of those remote possibilities in terms of what's the best way to reach each other should we be independent, like alone in a setting? And how do we use technology? How does that play into that so that we can keep each other informed and abreast in real time and communicating that? All right, so that is the conclusion to this. So, again, wanting to recognize the complexity of what we're facing in the field, making sure that we're prioritizing having workplace prevention strategies in place, that we're using our stakeholders across the community to help us, and then focusing on, those assessments. What are we doing in advance to make sure that we can, identify and mitigate risks early so that we have a prevention plan in place, and then ultimately having a plan in place through to support employee well-being for those employees that maybe have had those experiences or consistent experiences with patients that might be more challenging. What do we do to support them in the field so that there's they don't get burned out and don't feel unsupported? So, workplace violence is complex. We want to have a commitment from all of us, and education, prevention, and support are key. And then ultimately, we want to have safe healthcare environments that benefit workers, patients, and communities. Right, and there are references. All right, thank you for your time, and I will see you in another presentation. Have a great rest of your day.